Hi, my name is Chrissy Clements. Everyone watches accesstv.org.
Good morning. I'd like to welcome everybody to the challenge. Today's Thanksgiving, so we're going to start out by wishing everybody a happy Thanksgiving Day, and hopefully you spend it with your loved ones. Today we're going to talk about health. As we do on the challenge, we do hit issues that affect the black community. Health is definitely one, education, family, culture, but health is important because it kind of relates to a lot of other things that happen in our community. And we do challenge everyone every week to get involved in their community. And like I always say, get up, get out, and do something, whatever you can do to improve your life in your community. We encourage that. Today we have Leslie Gomez, a registered nurse working in the Hartford community with the population of Hartford. So we're going to get, as I always say, also we're going to get right into it. And I'm going to introduce our guest, Leslie. How are you doing today?
Good morning, Brian. How are you?
I'm doing great. Are you ready for the holiday today?
Of course, I'm always ready for some turkey.
Yeah, all right. That's one of the things. Actually, we'll get into that a little bit. Is diet and how that affects healthy lifestyle and stuff like that. So you're a registered nurse. Why did you decide to be a nurse?
As a child, I've always wanted to be a doctor.
Mhm.
I mean, I can remember telling my mom, or if someone asked me what did I want to be when I grew up, I always wanted to be a doctor. However, I didn't make it that far.
Mm-hmm.
But I grew up because I knew I wanted to take care of someone, help someone feel better. That, as a child, that's how I felt. So, I mean, I think that was just instilled in me, and I kind of pursued that dream.
All right. So, as a nurse, take us through like a day as a nurse. What type of nursing do you do right now?
I am a medical ICU nurse.
All right. So, what's ICU?
It's an intensive care unit. That's where the critically ill people come. That's basically your last stop. Is either you get better or you don't get better.
Right.
Kind
Okay.
of thing. And
So, like
in that unit, you have your life supports, um, your medicines that you can't run on the floor, that needs like your direct attention and things of that nature to help the critically ill get better.
So on a normal day, intensive care, as I'm envisioning it, is someone that's gravely ill. So it's not kind of like you're slow down. Is it fast paced? Is it?
You have your days. Most of the time it is fast paced. If you have a really sick person, like for instance, the patient to nurse ratio in the critical, the ICU unit is 2-to-1. So you have 2 very sick people to 1 nurse.
Wow.
Or if you have someone that is really, really, really ill, it might be 1 nurse to 1 patient, depending how busy that patient is.
All right. So it's some difficult and challenging work. What we do here on the challenge is also talk about people in our community, African Americans in particular. As a nurse, do a lot of African Americans come through the ICU?
They do. They do. They come through the ICU with, mainly you'll see diabetes, hypertension, or both, um, heart disease, and stroke.
Now, you mentioned diabetes, and I was some statistics I was gathering for today's show. I think it's about 9%. I mean, no, about 18.7% of blacks have diabetes. And you say diabetes, and then you say ICU, because a lot of times we don't associate the two. So, how does diabetes or a diabetic person, how would they end up in ICU?
Um, well, if they don't take care of it, I mean, if they haven't seen a doctor, a lot of minorities may not have health insurance, or, to continue, if they have seen a doctor, they don't have health insurance, so they become non-compliant. So the disease progresses, and then it affects other systems in your body, especially your heart, um, which leads to heart attack, which also can lead to stroke, because the plaque kind of builds up and there's no way for the blood to circulate in your brain, so it leaves it doesn't leave a way for the blood to circulate. So.
And let me ask you this: so, if we're gonna get into Obamacare, but just because one of the things, like I think a lot of systems is maintenance and prevention.
Right.
So, in our community, is it something that's manageable, diabetes? If people were, I don't know, I guess more knowledgeable about it.
Yeah, I think education is definitely the key in the community to help with those diseases such as diabetes mainly, and hypertension is another.
Now, hypertension is what for people that are listening?
High blood pressure.
High blood pressure.
Yes.
Now, you always hear that. I know coming up, I always hear that. When you go to the doctor, they always put the thing on your arm and check your blood pressure. What is it that they're doing in that instance right there?
Well, they're checking the systemic blood pressure, your systolic and your diastolic, which means, I won't get into all of that, but
All right. If it's high, you can.
If like I'll do with the numerical part of it,
Mhm.
like the basic is like 140 over 90
Mhm.
is like your baseline or your borderline high of high blood pressure. So they might not say anything on your first visit that okay, say your blood pressure is 142 over 85. Okay, your blood pressure is like borderline high. The next visit you come and your blood pressure is 150 over 90. He might say something about that. Usually they start with diet and exercise first as your first line of defense for hypertension. But if they find that either you're non-compliant with your diet or non-compliant with your exercise, they will start to prescribe blood pressure medication.
So what tends to happen is that, so if you don't address these early on, or as you're seeing the doctor, then they lead to these other conditions that will actually end up taking your life. Is that
Right.
all right? Now, you work in the hospital setting, in the community at large. How do we address that? Is it like through the Obamacare and preventive maintenance? You did mention a lot of African Americans you see coming through there. They don't have insurance.
Mm-hmm. Well, I think with the Obamacare coming in place, I think that would help a lot of the minorities or the people without medical care pursue their good health, basically.
Right. But what if, I guess one of the things is, how do you get our African Americans and people in the black community to understand that connection? Because I think one of the things is, if you're healthy, right, you're telling me about this thing that's gonna take my life, but I'm like, shoot, I'm fine. Right. You give me these numbers and this information, but I'm sitting in front of you feeling okay. So do you see that as something that we could work on as far as stressing the importance of addressing these issues before they get to see you, because I'm glad to interview you here today, but I don't want to see you at work. I don't want to see you at work because that means there's some health concerns that I didn't address, and now I'm in the ICU unit. So I want to get our numbers down in the ICU unit. So,
like I said, the ICU is kind of like
right,
the last stop. You know what I mean? I mean, this is something that has to go prior to someone coming to the ICU.
right.
I mean, you can come to the ICU for any reason. It could be your first encounter with diabetes or something like that.
Oh, so people could go undiagnosed.
Oh, definitely.
Oh, okay.
Oh, definitely. And like I said, the most important key to that is education, knowing those symptoms, knowing that you should see a doctor at least every year, whether you're healthy or not.
Right.
You know what I mean? Knowing your family history, that plays an important role in your health. Knowing what things may help cause whatever the diagnosis, diabetes or whatever. I mean, you need to know what to look for. Family history is a big thing.
All right, so all of that, you start, I guess you start on that, piecing together your medical health through going to the doctor, through setting up appointments. So yeah, hopefully as we move forward with, Connecticut has the Connecticut Health Exchange that they're kind of going to be introducing, I guess in the next 2013 or 2014, everything has to be in place. One of the other things is education. You mentioned that initially, and to become a nurse, so you have to go to school. Were there a lot of challenges kind of just navigating through the educational process, or did you find it?
As a minority, I mean, there is a lot of changes. I mean, from my experience, I had a child. I mean, she was my motivation. That's why I went on. As soon as she turned 1 year old, I was back in school, and I said I need to, you know, pursue my career now while she was young. I mean, it makes it difficult when you don't have like family support or financial support. You may still have to work while you're still in school,
Right.
which makes it more difficult. It might take you a longer time.
Right. So you had some challenges. So if a young person out there watching, because sometimes we don't see the end when we're kind of in the midst or at the beginning. So is it like work, or is it? Because don't you have to go through like an internship and all that? They don't just take you out of the classroom and say work in ICU, right?
No, I mean, usually, I mean, I recommend that you get a medical surgical background. I mean, like I said, I started out on a neurotrauma floor, which is medical surgical kind of thing. So I didn't directly go to the ICU. I had to lay that foundation first,
Right.
you know, and learn all those things that prepared me for the ICU.
Now I guess, and to kind of get a little bit serious, so everybody doesn't make it, right? Everybody that comes through the ICU, they don't make it.
Absolutely.
So how do you kind of like maintain the professionalism in your focus?
Sometimes you don't.
Okay.
Sometimes you get attached to your patients, and you might shed a tear.
Right.
You know what I mean? And sometimes it's important to shed a tear to that person to know that you were really sincere and compassionate about taking care of them and helping them, you know, get better. So, depending on the situation.
Oh, so it's not like to be tough and stay strong.
I mean, sometimes you do have to, depending on that person.
Right. So you gotta kind of make your I guess your primary role is to provide them with the care to save their life.
Yeah, you have to nurture them. You have to be compassionate. These are sick people.
Okay.
When I mean sick, I mean they can't do anything for themselves. Most of them cannot do. You have to do everything for them.
All right. Now, your ICU. Prior to getting the ICU, were you doing any other type of nursing before that, or because that's pretty serious? So you don't come right out of school into like the trauma unit.
Well, yes, you do.
Oh, you do?
To a trauma unit, you can go straight from out of school.
Oh.
That was my background. I've seen everything. You know what I mean? Everything.
Oh, so trauma. So ICU, intensive care. So they're kind of not in the emergency. They're sick, but not in the emergency room. Trauma is something a little bit different.
They have different specialties, basically. Like you have your cardiology floor, which specialize in cardiology patients.
Uh-huh.
You know, those nurses are they're learning not specifically, but majority they have those cardiac patients, so they specialize with that population.
Okay.
So if you come in with symptoms of a heart attack, more than likely the cardiac floor will get it before I do.
Oh, okay.
You know what I mean?
Right.
Not to say that I, as a trauma nurse, wouldn't be able to take care of a cardiac patient, but because they are more experienced in that area, they might be sent there.
So when someone says trauma, they mean
Trauma is falls, gunshot wounds, stab wounds, motorcycle accidents, skiing accident, anything that cause any kind of
so basically there was an incident that caused them to show up. If it wasn't for the incident, they wouldn't be there.
Right.
Right.
Yeah.
Okay. That's interesting. Now, other than that, what other type of nursing have you done?
I've worked with the special needs population.
What does that mean?
Anyone with any kind of intellectual disabilities, developmental disabilities, for a broader description, your population with mental retardation, and those kind of.
What about mental health? To me, just personally, I think that's a big contributing factor to a lot of issues in our community. Now, the mental health meaning like the PTSD, some of the depression. One of the statistics I was looking at on depression, we're about 4 or 5% higher as a population African American than the national statistics. And depression always leads to other things if it's not treated. What do you think about depression in the black community?
I think a lot of depression becomes becomes undiagnosed.
Mm-hmm.
I mean, I think we as black people, we think of depression, a lot of people tie it in with crazy.
Right.
You know what I mean? So they don't like to seek help for that because I don't know what it is about us, but we don't like to seek help about depression or be considered crazy. You know?
Right. So we misinterpret it. Is
Yes.
it something that's, if you're diagnosed with depression, is it something that's treatable?
It is treatable.
Can you be depressed and get treated and then go on to normal life?
You can.
All right. Now, if you are depressed and it's not treated, what are some of the health concerns that might result in undiagnosed or untreated depression?
Well, if you go through an untreated depression, it's like, you're more isolated. You don't want to go out into the community. It affects your what you do at work. It affects your interaction with your family. Someone is going to know that something is wrong,
Right,
and try to help you along the way. But I mean, rephrase your last part.
I mean, how does it work if you're diagnosed, you're diagnosed depressed, is untreated? What were some of the medical conditions that might result for undiagnosed depression?
Undiagnosed depression, suicide.
Yeah. Oh, so it could lead to suicide and stuff like that.
Mm-hmm.
So if someone was experienced depression, what is I don't want to get too far into it, but what are some of the symptoms of it, like that might lead a person to think, I maybe need to seek help?
Loss of appetite.
Mm-hmm.
Like I say, withdrawn from the people you normally might communicate on a daily basis, your family, your friends, or someone that likes to sleep all the time.
Mm-hmm.
You like to sleep all the time. Those are like the three main things that might trigger someone to say either, hey, something's wrong with so-and-so, or
Right.
you might not recognize it as the individual experiencing the depression because you're in that
Right.
depression. So it's important that people have support system, family and friends.
Right.
To help them through it.
One of the things that I looked at is going through the educational process is that an event can trigger depression, and I think what happens sometimes in our community, we'll experience something that's negative, and we don't get it treated, or we don't get it looked at, and we kind of just gloss over that, and just it leads to other conditions in our community. I know one of the outcomes of depression is addiction and stuff like that. In your work now today, because I'm trying to make some connections to like how we are, some of the life choices that we make, and some of the consequences to that. So in ICU, do you see people that suffer from like addictions and alcoholism and all that?
Yes. A lot of, I would say maybe 30% of the patients that come through the ICU have some kind of addiction to alcohol or drugs.
Oh, okay. And then now it's a result of, again, also untreated. So now they end up in ICU.
Yeah, well, the thing is, these people have drank alcohol for a lot of years.
Right.
Or done drugs for a lot of years. So now it has affected several systems in their body.
So okay, so long-term drug use used to diminish organs and stuff like that, which leads to bad health condition, which leads to death. So that's a good connection. Not trying to make light of it, but but seriously. So because what happens is, I don't want people to think that you just end up in this state, and a lot of stuff is treatable and it's correctable. If as the people we're kind of knowledgeable about that. I don't think the person that takes a drink at 16 sees themselves 40 years later in ICU,
No.
right? But it is a direct connection to your lifestyle and your medical condition.
Definitely.
All right, and then as African American, because I've been in the hospital, you might go to visit somebody, you might have to take somebody in there. I don't see a lot of black nurses. So as an African American nurse in that setting, what are some of the challenges working as a nurse in a predominantly, let's be honest, in a predominantly white population? How is that?
It's difficult. You have to definitely know your stuff. Education is definitely key. You have to work 10 times harder.
Oh, you
sometimes, a lot of times, than the what do you refer them to?
Then the mainstream. We'll call it the mainstream.
Yeah, the mainstream. You do.
Okay. Now let me ask you this: do you see in your work African Americans that are in leadership positions, or they're all kind of not?
We're all kind of not.
Okay.
I mean, if you want it, you can go get it. You're gonna have to fight for it. You're gonna have to work extra hard for it. It's not gonna come easy, So.
Because I guess one of the things that I think helps us along as a people is if more people look like us when we sought the help, we might be more accepting of the help. So, what do you think about the young sister or brother that's thinking about the medical profession as a chosen profession? What would you say to encourage them? Are they needed in the profession, more African Americans?
I think so, because I think if we had more African Americans in the community, we would be able to reach out more to the individuals that look up to us. You know what I mean? We'd be able to educate them more. They'll be more apt to probably digesting the information that we give to them as far as health consciousness.
Right.
You know what I mean?
What is health consciousness?
I mean, just health consciousness is just knowing about your health, knowing about those things that affect minorities more. Like, for instance, as you know, or as you don't know, African Americans are more apt to have hypertension and diabetes and are more affected with stroke because of our diet.
Right.
Our diet and smoking and alcohol, those all affect us as African American.
All right, so let me ask you this. So, because we have a few minutes left, what would be a healthy relationship with a medical provider as a young African American or any age African American? What should we be going to the doctor once a year, once every couple of years?
You should at least see your primary care physician at least once a year. And during that visit, you should have your lab work checked. And you should talk to your doctor about anything that might be disturbing you, whether it be depression or if you need any education on heart disease or stroke or diabetes, things of that nature, or anything that may be bothering you. That is the appropriate time to talk with your doctor. But even if you're having an issue, you should seek medical advice from a doctor as well.
But so as
a healthy person,
you should be going to the doctor at least once a year. And then within that once a year, you want to get all your concerns addressed. But you don't, I guess you should have kind of like a relationship with your doctor, correct? You should be able to, other than your checkup, are you able to?
If you're having an issue, you should be able to call your doctor and make an appointment to see him and discuss whatever the issue is.
Now, is there any, because I guess communication, sometimes people will say the doctor was rough or they weren't, they don't. So is there any recourse if you're a patient and you're seeing someone and you don't feel comfortable? Because I think it's so difficult to get us in there. If there's any type of friction within that patient-doctor relationship, what can the patient do to kind of get the resolution that they might be seeking?
You're saying if they don't
get along,
yeah. Well, there are plenty of other doctors. You might want to talk to someone that has a doctor that that feel that is a great doctor, that a great listener, that has that bedside manner. Get some kind of recommendations from one of your family friends or coworker.
All right. Now, I noticed, but people don't know that you're still going to school. So as you move forward in this profession, where do you see yourself in 5 years from now, or what are you doing, pursuing like additional education?
Okay. Well, currently I have my Associates of Nursing degree. I am looking to pursue my Bachelor's of Science degree, which is a 4-year degree in nursing, which is, I see myself either obtaining my APRN degree, which is an Advanced Practice Registered Nurse, or nurse anesthetist.
All right, so when you say advanced practice, so that allows you to kind of move into some of these supervisory roles. So to the young African American nurse that hasn't entered the profession yet, when they get there, they will start to see more people of color in hospitals that predominantly serve people of color doing the professional work. So that's a great thing. Now, you get your APRN and you get your other master's degree. Do you want to still work in a hospital setting, or do you see yourself moving into like a more practice or primary practice?
I probably see myself more working in the hospital setting.
Okay, so you like that that atmosphere.
Yeah.
All right, and go ahead.
Brian, one thing I want to touch upon about speaking with a doctor, I noticed that working in the hospital that most minorities or African Americans or Hispanics, they don't have primary care physicians. They use the emergency room as their first contact as a doctor.
Okay.
And so a lot of times that's not appropriate because they'll come in for a bellyache.
Right.
And they sit there for hours.
Right.
And they get upset because there's other people that come in with more emergent conditions that need to be attended first. They come in because they have a pain in their leg. And I think if we can, educate the people to get a doctor that's already in the community. Don't use the emergency room as their first contact because they might not get the care they're looking for or the advice that they're looking for
And they don't get the preventative piece, though,
No.
right? Because you're only going to address the bellyache.
Right.
They're not going to address none of the other just day-to-day
Absolutely.
life concerns that might occur. All right, Leslie, I really appreciate you coming in today. It was a great interview. I think we learned a lot about health in the Black community and in the profession. And have a happy Thanksgiving.
Oh, thank you. Thanks for having me.
Yeah.